This single exercise for glutes works better than 50 squats. Do it every morning. There is a number that should frighten anyone over 50 years old. Nearly 90% of hip fractures are caused by falls inside the home, not in car accidents or sports, in a common fall. And at the root of that, almost always lies the same problem. The glute, the largest muscle in the body, slowly going dormant after hours spent daily in the same position. That is why today you will see the single exercise you need to strengthen your glutes. And as a bonus, 6 other equally good options to do at home. You do not need to do all of them. Watch until the end, see which ones fit your body and your routine best, and start with those, aiming only to stay consistent. And the best part, no need to punish your knees with the traditional squat. Exercise number 1, fire hydrant. The fire hydrant is one of the few exercises that can isolate the gluteus medius almost entirely on its own. That lateral muscle sitting just below the hip that is primarily responsible for keeping you upright and stable when walking on uneven terrain or climbing stairs too quickly. Most people train their glutes thinking only about squats and stiff leg deadlifts, completely forgetting this lateral portion, and then wonder why they feel that strange instability in the hip when running or dancing. Contrary to what many people think, this is not just an aesthetic exercise. The gluteus medius works together with the hip stabilizers to prevent the pelvis from dropping to the side every time you shift your weight onto one leg, which happens hundreds of times a day. When this muscle is weak, the body compensates in other ways, usually overloading the knee or the lower back, and that is where many chronic pains begin without any apparent cause. To perform the exercise, place your hands and knees on the floor, keeping your spine neutral and your core lightly engaged. Without changing the angle of your knee, raise one leg out to the side, as if you were lifting your leg like a dog urinating on a fire hydrant, which is where the movement gets its curious name. Raise until you feel the lateral glute contracting forcefully, pause for 1 second at the top, and lower in a controlled manner, without letting the knee simply drop by gravity. An extra tip that makes an enormous difference in results is to keep the hip as still as possible during the movement, avoiding rotating the torso to help the leg rise higher. Smaller and controlled range of motion is worth far more than a large range of motion with compensation. If you want to increase the difficulty without any equipment, simply try increasing the time under tension by pausing 2 seconds at the top of each repetition. The most common mistake here is using the momentum of the whole body to swing the leg upward, transferring the work to the lower back instead of the glute. Another frequent mistake is opening the hip too far to the side, which actually removes tension from the target muscle. Pay attention to the burning sensation on the side of the glute. That is the signal that muscle recruitment is correct. For those just starting out, 2 to 3 sets of 12 to 15 repetitions on each side are usually enough to feel the muscle truly working. More experienced practitioners can progress by increasing the pause time at the top of the movement or gradually increasing the number of repetitions. Contraindications. People with hip bursitis in an acute phase or significant knee pain when bearing weight on the floor should be cautious and may support their hands and knees on a softer surface, such as a thick mat, to reduce discomfort in the joint. Exercise number 2, frog pump. The frog pump, as it is also known, became popular for a simple reason. It can generate a level of glute muscle recruitment comparable to weighted exercises using only your own body weight. An electromyography study comparing variations of hip raises found gluteus maximus activation close to that observed in traditional gym exercises, which reinforces that this simple movement should not be underestimated. Unlike the traditional hip thrust, here the feet are placed together, sole to sole, with the knees open to the sides, forming a position similar to that of a frog, which slightly changes the angle of work and increases the involvement of the adductors alongside the gluteus maximus. This combination makes the frog pump an excellent option for those who feel lower back pain when performing the traditional squat, since the lower back barely participates in the movement at all. To perform correctly, lie on your back with your knees bent. Press the soles of your feet together and let your knees fall out to the sides at whatever range is comfortable for your hip. Contract the gluteus maximus and push your hips upward, keeping your feet together throughout the entire movement. At the top, squeeze the glute firmly for 1 second before lowering in a controlled manner without letting the hips hit the floor between repetitions. The tip that most increases the efficiency of this exercise is to think about pushing the hips upward using the glute, and not simply arching the lower back to gain height. Many people make the mistake of elevating the hips primarily using the lower back, which removes tension from the gluteus maximus and can also cause discomfort in the lower back after a few repetitions. Another common misconception is thinking that because it is a floor exercise, it has no value for those who have been training for years. In practice, many advanced practitioners use the frog pump as activation before a leg workout, precisely to ensure the gluteus maximus is recruited before heavier exercises, such as the squat. For beginners, 3 sets of 15 to 20 repetitions are usually a good starting point, since this is an exercise that targets muscle fibers that respond well to higher volumes. For progression, increase the isometric pause time at the top of the movement, going from 1 to 3 seconds before adding more repetitions. Contraindications: people with recent knee injuries that prevent full flexion of the joint, or with significant pain in the groin area, should reduce the range of knee opening or avoid the exercise until reassessed by a healthcare professional. Exercise number 3, step up. The step up is, in practice, a simulation of climbing stairs, but performed in a controlled manner with full focus on activating the gluteus maximus. This makes it one of the most functional exercises on this list, because it trains exactly the movement pattern you repeat several times a day without noticing, and one that tends to become increasingly challenging as the years go by and leg strength gradually diminishes. Unlike bilateral exercises such as the squat, the step-up works one leg at a time, which demands more from the hip and ankle stabilizers and improves proprioception, the body's ability to sense its position in space without relying solely on vision. This characteristic makes the step-up especially valuable for those over 50 years old, since good proprioception is one of the factors that most protects against falls. To perform the exercise, place one foot completely on a stable, elevated surface, such as a sturdy step, at a height of approximately 16 inches for most people, adjusting according to individual mobility. Push your body upward using primarily the heel of the leg that is on the step, avoiding pushing off with the lower leg. At the top, fully extend the hip before lowering in a controlled manner, without letting the body drop all at once with full weight. The tip that makes the biggest difference here is to focus the weight on the heel of the supporting leg, and not on the ball of the foot, since this shifts the work toward the gluteus maximus and the hamstrings instead of overloading only the quadriceps. It also helps to keep the torso upright throughout the entire ascent, avoiding leaning forward to gain momentum. A very common mistake is using the leg on the ground to push off, which drastically reduces the work done by the leg that should be trained. Another mistake is choosing an excessively high step right from the beginning, which compromises technique and increases the risk of losing balance, especially for those still developing strength and confidence in the movement. Start with 2 to 3 sets of 8 to 10 repetitions on each leg, always prioritizing quality of execution. To progress, first increase the repetitions up to 12, and only then consider gradually increasing the height of the step. Contraindications: people with significant balance instability should perform the movement near a support, such as a wall or handrail, and those with acute knee pain when climbing stairs should reduce the step height or temporarily substitute another exercise from this list. Exercise number 4, donkey kick. The donkey kick is probably the most well-known exercise on this list, but also one of the most poorly executed. Most people focus on lifting the leg as high as possible, without realizing that, past a certain point, that extra range of motion begins to come from the lower back rather than the gluteus maximus, which reduces the real benefit of the movement and can also cause discomfort in the lower back. Few people know this, but the gluteus maximus is the largest muscle in the human body, and yet it is one of the most neglected, especially by men who focus nearly all their attention on the chest and arms at the gym. This exercise intensely works the gluteus maximus, especially in the final phase of the movement when the hip is in full extension. This is precisely the phase that tends to become weak in people who spend many hours sitting, since the seated position keeps the hip chronically flexed. To perform correctly, support your hands and knees on the floor with the spine in a neutral position and the core lightly activated. Keeping the knee bent at an angle close to 90 degrees, push one foot upward and backward as if you were kicking a wall behind you. Rise until you feel the glute contracting with maximum force without the lower back beginning to arch, and lower in a controlled manner until the knee almost touches the floor again. The tip that most helps maximize this exercise is to imagine that you are pushing your heel toward the ceiling and not simply lifting the knee. This small mental adjustment usually immediately improves activation of the gluteus maximus. Another valuable tip is to reduce the range of motion if you notice the hip rotating to the side during the ascent. The most frequent mistake, as already mentioned, is seeking excessive range of motion at the expense of the lower back. Another common mistake is using momentum, swinging the leg upward quickly instead of performing a controlled movement that truly demands effort from the glute from start to finish of each repetition. For most people, 3 sets of 12 to 15 repetitions on each side work well. As a simple progression, increase the isometric pause time at the top of the contraction, going from 1 to 2 seconds before adding more repetitions. Contraindications. People with active lower back pain should significantly reduce the range of motion and focus only on glute contraction without raising the leg too high. And those with recent knee injuries should avoid placing weight directly on the joint without a mat or padded surface. Exercise number 5, side-lying leg raise. The side-lying leg raise is a simple but extremely efficient exercise for working the gluteus medius, the same lateral portion of the glute we discussed in the fire hydrant, but now in a different position, which slightly changes the muscle recruitment pattern and allows you to work the muscle from another angle. This exercise is often one of the first recommended by physical therapists for patients with lateral hip pain or instability when walking, precisely because it demands very little from the rest of the body and allows you to almost completely isolate the gluteus medius without interference from other larger muscle groups, such as the gluteus maximus or the quadriceps. To perform the exercise, lie on your side, resting your head on your lower arm or on a pillow, and keep your body aligned without letting the hip rotate forward or backward. With the top leg straight, raise it slowly until it reaches a comfortable angle without lifting higher than the hip can sustain without compensating with the torso. Lower in a controlled manner, without letting the leg simply fall by gravity. The most important tip here is to keep the hip locked in place without letting the entire body rotate backward as the leg rises, which is an extremely common mistake and drastically reduces activation of the gluteus medius. Pointing the toes slightly downward during the ascent also tends to increase the burning sensation in the target muscle. Another frequent mistake is performing the movement too quickly, using the momentum of the leg to gain range of motion instead of controlling each phase of the movement. Remember that during the eccentric phase, meaning the descent, the muscle continues working intensely, so lowering slowly is just as important as rising with control. For most people, 2 to 3 sets of 15 to 20 repetitions on each side are usually enough to feel the gluteus medius truly working. As a progression, first increase the time under tension by pausing 2 seconds at the top of each repetition, before increasing the total number of repetitions. Contraindications. People with trochanteric bursitis in an acute phase, meaning inflammation on the side of the hip, should reduce the range of motion or temporarily avoid the exercise until the inflammatory condition improves. Exercise number 6, sumo squat. The sumo squat is a variation of the traditional squat that, due to the wider stance of the feet, changes the distribution of muscular work, increasing the involvement of the adductors and the gluteus maximus compared to the conventional squat. Research comparing stance widths in the squat found greater activation of the inner thigh and glute in wider variations, confirming what many trainers had already observed in practice. This exercise tends to be more comfortable for the knee than the traditional squat, since the wide stance allows the knee to travel in a path more aligned with the direction of the feet. Beyond the aesthetic benefits, developing the gluteus maximus also increases post-workout calorie burn, thanks to the effect known as excess post-exercise oxygen consumption, the extra oxygen the body continues to consume for hours after exercise to recover. To perform the exercise, stand with your feet much wider than shoulder width apart and toes slightly pointed outward. Lower by flexing the hips and knees simultaneously, keeping the torso as upright as possible and the weight distributed across the entire foot, not just the toes. Descend as far as your mobility allows, ideally until the thighs are parallel to the floor, and rise by pushing the floor forcefully, contracting the gluteus maximus at the top of the movement. The tip that most improves execution is to imagine that you are trying to spread the floor apart with your feet throughout the entire descent and ascent, which activates the hip stabilizers more and keeps the knees aligned with the feet throughout the entire movement. Keeping the core engaged also helps protect the lower back during the lowest phase of the squat. The most common mistake is letting the knees collapse inward during the ascent, which removes tension from the glutes and unnecessarily overloads the joint. Another frequent mistake is leaning the torso too far forward, shifting part of the work to the lower back instead of keeping the focus on the hips and legs. For beginners, 3 sets of 10 to 12 repetitions tend to work well. As a simple progression, increase the time under tension by lowering more slowly, taking about 3 seconds on the way down before increasing the number of repetitions. Contraindications. People with recent hip injuries or significant mobility limitations in that joint should reduce the range of motion, descending only as far as is comfortable. Reassess progression with professional guidance. Exercise number 7, lateral lunge. The lateral lunge is one of the most complete exercises on this list because it combines work for the gluteus maximus, gluteus medius, and adductors in a single movement, while also demanding significant proprioception and control, since the body moves to the side rather than following the more linear movement pattern of everyday life. This exercise trains a plane of movement that tends to be neglected in most routines. Regular practitioners can notice improvement in lateral balance relatively quickly, which translates into greater confidence in everyday activities, such as stepping around a sudden obstacle on the street or getting into a car without losing stability. To perform the exercise, stand with your feet at hip width and take a wide step to the side, keeping the other leg straight. As you plant the foot on the floor, flex the knee and hip of the leg that moved, lowering your body as if you were sitting back, keeping the torso upright and the weight concentrated on the heel of the bent leg. Push forcefully into the floor to return to the starting position, contracting the glute as you rise. The most valuable tip here is to keep both feet pointing forward throughout the entire movement, resisting the natural urge to rotate the foot of the bent leg outward. This maintains correct knee alignment and maximizes recruitment of both the gluteus maximus and gluteus medius at the same time. A common mistake is taking too short a step to the side, which turns the movement into something resembling a partial squat and reduces the specific work on the lateral glutes. Another frequent mistake is letting the knee travel too far past the line of the toes during the descent, which can cause discomfort in the joint over time. For most people, 2 to 3 sets of 10 to 12 repetitions on each side are enough to start feeling results. As a progression, first increase the depth of the movement before increasing the number of repetitions, always respecting the mobility limits of your own hip. Contraindications: people with injuries to the medial collateral ligament of the knee or significant groin pain. When opening the legs laterally should reduce the step range or avoid the exercise until guidance from a healthcare professional is obtained. If you enjoyed this and would also like to see a complete at-home workout for the other leg muscles, we have a video appearing on screen right now showing more about how it works. Strengthening all the muscle groups of the legs is very important if you are already over 50, so make sure to check it out. Thank you for watching all the way through, and may God bless you, my friend.